Hi everyone, my name is Stephanie Zaragoza and this is my presentation for a slap tear rehab. My athlete is Angelica Delgado. She is a 32-year-old female and a judo fighter. She is in great health but suffered an injury during a fight. After falling on an outstretched hand, she began to feel dull shoulder pain, her arm going dead, and she also had pain with lifting objects over her head. After some tests, we concluded that she had a slap tear in the left shoulder. What is judo? Judo is an unarmed Japanese martial art as well as an Olympic sport, and it is also one of the most practiced forms of jacket wrestling competed internationally. The objective is to cleanly throw, pin, or master the opponent. Judo is best known for their spectacular throwing techniques, and as we can tell in the video, is a very physically demanding sport, specifically a high-intensity anaerobic exercise itself. So we have to make sure to keep her total body up to par. In the shoulder, we have the glenohumeral joint. This is a ball and socket joint with 3 degrees of freedom. It is made up of the humeral head and glenoid fossa of the scapula, and it is a very unstable joint due to the size difference of a large humeral head and the shallow glenoid fossa. The glenohumeral joint is responsible for flexion, extension, abduction, adduction, internal and external rotation, horizontal abduction and adduction, and circumduction. In the glenohumeral joint, we have the glenoid labrum. It is made up of fiber cartilage, and its function is to increase the joint stability. This is done by deepening the articular surface of the glenoid cavity, and this is also an attachment point for the tendon of the long head of the biceps tendon. So what is a slap tear? It is a superior labrum anterior to posterior tear. In the video, it shows that the tear occurs at the point where the bicep tendon anchors to the labrum at the top of the socket. This can occur from falling on an outstretched hand, quickly lifting a heavy object overhead, from a forceful overhead movement in a sport or activity, and it also can be a result of a direct blow as well as overuse. Some signs and symptoms you may experience if you have a slap tear are deep shoulder pain and tightness. There can be popping, clicking, grinding, and there also will be a decrease in athletic performance. And you also feel your arm go dead, and as well as having pain when lifting objects over your head. There are many classifications of slap tears, but the original 4 classifications are Type 1, Type 2, Type 3, and Type 4. In Type 1, there is fraying of the superior labrum without compromise of the labral attachment. This is often due to degeneration. It's commonly asymptomatic, but it doesn't require surgery. Physical therapy is usually recommended. In Type 2, there is detachment of the superior labrum and biceps anchor from the supraglenoid tubercle. This is the most common form seen and needs surgery. In Type 3, we see a bucket handle tear at the superior labrum without extension into the long head of the biceps tendon. And in Type 4, we see a bucket handle tear of the superior labrum with extension into the long head of the biceps tendon. In both 3 and 4, there's normally the need for a resection of the bucket handle tear. Some diagnostic tests we can use to diagnose a slap tear are special tests such as the crank test. In this test, the patient will be seated and the examiner will hold their arm at 90 degrees of abduction and 90 degrees of elbow flexion. Then they will passively internally rotate the arm. Then we also can do the O'Brien's test. In this test, the patient will be seated. They will have their arm flexed at 90 degrees, then horizontally adducted about 15 degrees. The patient will then have their wrist neutral, so neither impronation or supination. Then the examiner will apply resistance and instruct the patient to keep steady. There should be no pain in this position. Then the patient will pronate their wrist as much as they can. Then the examiner will apply the same amount of pressure. This usually will result in pain, which would give us a positive test. Then there could be an arthrogram MRI done. This is like an MRI, but there is fluoroscopy used in addition to the MRI. This is injected directly into the joint, giving us a more highlighted view of the injury. Now for my rehab plan, we start in phase 1, the inactive phase. This is weeks 0 to 4. Our goals are to decrease swelling, minimize pain, and gently begin active range of motion with no large movements. We want to apply ice to the swelling for 10 to 20 minutes, 3 to 4 times per day. And the arm is kept in a sling, immobilized in internal rotation until week 3. External rotation is not allowed and abduction is limited. Then in phase 2, this will be from weeks 4 to 8. Our goals are to improve active range of motion and passive range of motion, improve flexibility, and have pain-free range of motion. Some exercises that can be done in this phase are pendulums. In this exercise, the patient will place the right arm on a stable surface, such as a table, and let their left arm hang. They will do swinging motions, but we have to make sure that they aren't using the arm, but their whole body to move. Then we will do passive external rotation with a stick, where they will be laying down and they will use their arm to passively externally rotate the left arm. Then we will have them do a seated scaption raises. All exercises should be done every other day. And for their total patient, we want to remember that they have a lot of high interval intermittent movements. So we're going to have her do a dynamic warm-up followed with a 2-mile run and finished off with box jumps. In phase 3, we are working on strength and endurance and their overall proprioception. This will be from weeks 8 to 12, and our goals are to maintain pain-free range of motion, improve proprioception, strength, and endurance. To improve the strength and endurance, we're going to do TheraBand internal rotation and sideline external rotations. Both will be done for 3 sets of 15 every other day, and we'll increase intensity by changing the band color or adding a heavier dumbbell. Then for proprioception, we have rhythmic stabilization and shoulder taps. To increase intensity for the stabilization exercise, we will have the patient hold a kettlebell upside down while there is resistance being applied. And for the shoulder taps, we will increase intensity by having the patient close their eyes and perform shoulder taps for a longer period of time. Both exercises are done for 3 rounds of 30 to 60 seconds every other day. For the total patient, we will have reduced sprints where each round gets 5 yards further down a field, as well as an assault bike at about 70% of her max force for 5 intervals of 30 seconds. All exercises should be done every other day. In phase 4, this will be weeks 12 to 16. Our goals are to restore functional ability and start sport-specific exercises. The first exercise we have is a medicine ball around the world slam. That is going to restore her ability to provide that explosiveness she needs during the fight. She will do this for 3 sets of 10 on each side with a 30 to 60-second break in between. The next exercise we have is a thigh roll to be done with rotation swing. This is mimicking the movement that Angelica is likely to do in judo. This will be done for 30 seconds, as many reps as possible with a 30 to 60-second break in between 5 times. A random fun fact is that thigh roll actually means body drop, as in the Then we have the medicine ball overhead toss squat with a slam. This is going to help her explosiveness as well, that is needed when trying to bring an opponent down. She will do this for 3 sets of 10 with a 30-second break in between. All exercises should be done 5 days a week.